it really is a support network that exists in no other funding or other opportunities that I've been associated with. I think that is really a big testament to what they bring to Colorado and to the programs that they're supporting here.
From advancing the science that saves and enhances lives to innovating the therapies that help heal the body, the biomedical research taking place in Colorado's laboratories is crucial to improving human health.
Modern medicine has done amazing things, but a lot of lung diseases and other diseases remain where we don't have good therapies. And so it's that disappointment that motivates me. We have to get in the lab and figure this out.
This commitment to excellence in medical science has deep roots in our state's history. In the early 1900s, Dr. Gerald Webb, an attending physician at Cragmore Sanitarium, not only cared for those with tuberculosis, but worked to prevent the disease. There, he met James Waring, a medical student being treated for TB. Doctors Webb and Waring went on to pioneer research focused on disease prevention and treatment. Today, their legacy lives on through the Boettcher Foundation's Webb-Waring Biomedical Research Awards. The funding program was the result of a unique partnership between the Boettcher Foundation, the Webb-Waring Foundation, and the University of Colorado.
The recipients of these awards are really the rock stars of the future generation of biomedical researchers, and we really have the privilege to help accelerate their career, to retain them in Colorado, and to hopefully increase the impact of their research in a shorter period of time.
Each year, the Boettcher Foundation partners with Colorado's top research institutions to select the most promising early career scientists for the Webb-Waring Biomedical Research Awards. Award recipients are known as Boettcher Investigators.
From my perspective, it was the best grant that one could have ever started out their career with, because it really touched on what academics is really about, and that is about doing phenomenal research.
Boettcher Investigators receive funding for 2 to 3 years to advance their research so they are more competitive for major funding. The timing is key.
Awards such as the Webb-Waring Biomedical Research Award provide funding in this critical window of time when a young faculty member is trying to get their laboratory or their research program off the ground, get the data one needs to submit to larger funding agencies, and at the same time publish their research in highly respected journals.
It's a vulnerable time. It's a time where people in the field drop out of science altogether.
Boettcher investigators typically go on to receive significant federal grant funding much earlier in their careers.
It worked exactly as it was supposed to with me, and I was lucky enough to, about 2 years into the, 1 or 2 years into the Boettcher Award, to receive my first independent grant from the NIH.
The National Institutes of Health awarded Rachel Siemens funding for her research on lung repair, and Melissa Reynolds was awarded a grant from the Department of Defense for her work to support wound healing. The Boettcher Foundation's Webb-Waring Biomedical Research Awards play a vital role in supporting the scientists who are making these important biomedical discoveries.
The Boettcher grant has just given me the opportunity to set a foundation for what is going to be my own independent research career, and it's just given me the time and resources to start to ask a lot of questions that I plan to spend the next 20, 30 years answering.
Investing in early career investigators helps Colorado retain its top biomedical research talent and ultimately enhance the health of our communities.
I will forever be grateful for that funding, and that has opened up possibilities for additional funding as well as collaborations that would have never been possible without that. It will be the building point for probably the rest of my career.